Hello and good afternoon to all you wonderful social workers. Um, I am going to look here and see if there's anyone that I could quite possibly invite quickly just to join in. I put up a question this morning, as I always do, early morning, and in the midst of that, you guys were doing such a wonderful job with responding to the question. And I just kind of wanted to discuss this question a little bit. I think it's a pretty good question to review and go over. Um, I enjoy doing impromptus because I never really know um, when I'm going to have time to be online. And so when I get an opportunity or when I get a chance to, I just like to jump on and just share. I see some people are coming in, and for those who are popping in right now, hello. Thank you for joining in. I just want to try and give just a moment to see if I could get some more viewers. Um, I invited a few just who I was able to see on my contact list. But outside of those folks, hopefully some other people can join in. If you can't participate in this live, that's quite all right. It'll still be posted in the group, and you can always check the replay or catch it on YouTube and participate or see the discussion there. I'm not a pro at this, still getting used to talking live and talking to folks that I can't see. But I am on my lunch break. Well, not my lunch break, kind of like in between sessions. So I'm about done for my day and about to head home after I finish up with you guys and go ahead and start part two of my day. And part two of my day is you know what that is, being a mom. I don't take that for granted. I love being a mom. I love what I do. And I love how my son keeps me on my toes. So welcome to everyone who's joining in. For those of you who don't know me, my name is Bridget Montgomery. I am a master's social worker. I am a licensed clinical social worker. I also hold a master's in nonprofit management, and I am a national certified sex offenders treatment specialist. Outside of that, I am also a special education teacher, so I'm a certified special education teacher. And I share all that for a couple of reasons. One, people see the initials behind my name. They're always curious about what it all stands for. So I kind of share that too. I share it because I think it all works really well and it ties in well with being a social worker because of the type of work that I do and the type of consumers that, I treat. Nevertheless, taking that into consideration, even with the experience, even with the knowledge, even with, how long I've been in the field, I still come up against some challenges. And one of the challenges I often, find myself coming up against is really working on these particular test questions, right? Now, just to kind of let you guys know, one of the things that I do, I really like to try to help social workers who are preparing for their exam really learn how to look at these questions, process it, read through it, and enact the skills, activate the skills that you already have. You know this information. You've been doing social work for many years. Some of you, you've gone through a couple of years of your master's program. We're all master's level social workers here. Some of us are licensed social workers and some of us are not. And some of us are working for that last level of licensure, which is the clinical licensing. Nevertheless, what I need you all to understand and what I need you all to know is that you know the material and you are more than enough and you are capable. So with all that being said, let's go ahead and look at the question. Some of you probably already saw the question and maybe even answered it. If not in this group, maybe even in another group, but that's okay. My purpose here is not really to go over the question and see if you can answer the question correctly or choose the best answer response. But my purpose here is for really looking at the question and looking at how to read through the particular question and pay attention to the wording so that you can arrive at the best answer choice. So let's go ahead and take a look at this and take a read, right? So what do we have here? Okay. A social worker has been meeting with a 10-year-old child on a weekly basis for about 4 months. The child's depression has improved, and the social worker is discussing termination with both the child and her mother. The mother expresses concerns that the child will get worse once services has ended. What is the best response? A. Discuss ways to respond and skills to use if the child has problems following termination. B. Continue to meet with the child as it is possibly too soon to terminate treatment. C. Continue meeting but decrease the frequency of sessions to once a month. Or D. Explain to the mother the need for termination and give the restrictions of managed care. Okay, so there's a lot going on here, right? And first, what we really want to look at, we want to ask ourselves, so what is really going on here? What is this scenario assessing and what is it testing, right? What is it asking us to know or understand? And what we're dealing with here is a situation with termination of services, right? So we're in that ending phase of treatment, right? And we're looking at termination of services. Let me see if I can do this with you guys. So let me shrink this a little bit to make sure that you all will be able to see it on the screen. And I'll be able to do this, right? And also what we have here, okay, so the mother said to you, the social worker, that she's concerned that if you terminate services, that her child will get worse, right? So when we're thinking about what is the issue or the problem, what we want to look at is how do we address that problem, right? Overall, in this larger scenario, we have the situation here as the mother having some concerns about her child being able to handle termination, right? So the problem is the mother is concerned that her child's behavior will get worse once services has ended. Now, when I see that, what generally happens is something just kind of clicks in my head, right? And what that shows me is that, yes, mom is experiencing some anxiety, and that's okay. You know, we're talking termination. We know that there has been an ongoing relationship, right? And that you've been working with this client for about 4 months, right? So you've been doing good work with this family for about 4 months as the social worker, right? And after 4 months, you came to a determination, what? That this kid is ready for discharge. So we got some key words in here, right? So I want you to pay attention to this. Here, after 4 months of working with this family, after 4 months of working with this child, right? As the social worker, you recognize what? Key word. The child's depression has improved. So you want to pay attention to that. We don't want to discount that. We want to pay attention to that, and we want to note that. So that's something you want to focus on. So you're noticing that the child's behavior has improved, and because of that, you're ready for termination, right? You've made that determination. You've assessed that this child has moved to a phase in treatment where he's ready to be discharged. He's ready to move on because you've taught him skills, you've assessed the situations, you've been working with mom, you've been implementing different strategies, and you're giving them the tools that they need to be able to be successful and stand on their 2 feet. Now, we do know that with termination, all types of feelings can arise, and that's okay. This is where we begin to synthesize information. This is where we begin to take the prior knowledge that we already have and bring it into the new information that's before us. And what we do know is that when you get to the termination phase of treatment, there is some kind of ambivalence that may arise. Sometimes it's with the client, sometimes it's with the therapist. And so we always need to be checking in with ourselves, right? But given the 4 answer choices that we have here, we got A, What should we do? Or what's the best response? How should you respond to this mother who have these concerns? Now, again, for the purpose of the exam, there are so many different ways we can look at this. There are so many different ways that we can answer this, and there are so many different ways that we can process through this. But because we're taking this exam and they're only giving us 4 answer choices, we have to look at the answer choices that they're giving us, and we have to identify the best one out of the 4. So given the 4 answer choices, what's our best option here? We have A, should you discuss ways to respond and skills to use if the child has problems following the termination? Or B, continue to meet with that child as it is possibly too soon to terminate? Or C, agree to continue meeting but decrease the frequency of sessions to once a month? Or D, explain to the mother the need for termination given the restriction. Okay, so we do know the person that we need to be addressing here is the mother. She's the one with the concern. She's the one that's really upset, right? And her concern is that what's going to happen to my child once we discharge, or once we stop seeing you, once we stop coming in here to seeing you. His behaviors may get worse. I'm a little worried about that. I'm a little nervous. And, I'm hearing this from this mother. I'm hearing these concerns. And now, I have to think, okay, what is the best response? How should I respond to this mother? Right? So that's your instructions. What is the best response? Well, I'm going to rule out D, right? Explain to the mother the need for termination given the restrictions on managed care. Well, I could say no to this because why? When it comes to managed care, every situation is different. Everybody don't have restrictions. Some people have unlimited amount of services, unlimited amount of time that they can receive mental health services or behavioral health services, depending on what their insurance carrier is. And so that wouldn't work because that just limits everything. It doesn't say that, she's been authorized for 10 services. And so they've met, the 10 services. And so now, it's time for discharge and to go back and ask the insurance to increase services, all that's a whole lot. So no, it just doesn't fit here, right? Depending on the insurance provider will determine how long you can receive services. I personally, true story, have clients that I've been seeing for well over 5-6 years, just ongoing, may have taken a break here or there. But for, the long haul, I've been seeing for well over 5-6 years. So it will determine how long you can receive services, right? So D is out. C, agree to continuing to meet, but decrease the frequency of sessions to once a month. But when we look at this, right, one of the problems that I have with this, continue to meet, but decrease the frequencies to at least 1 session a month. The problem with this is that you're teaching this family how to become dependent on you. You've given them skills. You've taken time out to work with them. You've processed things with them. You've showed them how to do and how to handle situations. You talked about the triggers. You talked about the coping skills. Whatever the case may be, however you process and work through that situation with this child during those 4 months, you gave them the tools. And now continuing to meet with them after you've made a decision to start the termination process because you believe that he's reached the phase in his life where he's ready to transition would be kind of going against what you've already said. So I would say no to C for that same purpose, for that same reason, right? And then we have B, continue to meet with the child as it's possibly too soon to terminate. Well, again, that kind of contradicts what you've already said. Here in the scenario, it says the child depression has improved and the social worker is discussing termination with both the child and her mother. So here she's saying his depression has improved. I think he's ready, to, transition and begin to work on things on his own and begin to take this information with him and incorporate it in his day-to-day life. So to go and say B is the correct answer or the best answer choice would be contradictory. And so that leaves us with the only option, which is A, discuss ways to respond and skills to use if the child have problems following termination. So when I read this, what I saw is that, okay, Mom, I understand that you're, worried about how your son may handle, transitioning on and not being able to come in, each week to process and work through and talk about situations. But this is what we've been working on. We've been working on preparing him for this day, for this time, so that he can transition. Now, here's what we can do. So now what you want to do is kind of give her information in regards to if he was to transition and turn for the worse, what could the follow-up be? What about the aftercare resources? What about, getting him involved with different things? And so, you're not just terminating the child and just letting them go with no aftercare or no plan in place, but you will be terminating. That's part of termination. You will be terminating with an aftercare plan, with some follow-up resources, what information regarding to how the mother can either get back in contact with you or, utilize other services if needed, if the child was to, take a turn for the worse. And so with that being said, out of the 4 answer choices that are given, choice A is a yes and the best answer choice, for the simple fact that you've taught him skills, right? You want the skills that you've taught this child to use to be implemented. You want the work that you've done with him and the mother, you want them to be confident, self-assured, and, feeling as though they can handle situations on their own. And so that's what you've been prepping them for. That's what you've been teaching them. That's what you've been providing support for, to help them one day be able to stand on their own too. That's all I have for now. I did earlier in the day, when I posted the question, I did leave the rationale, and I want to leave that with you as well today. So when we look at the rationale behind why answer A is the best choice, let's see what they have to say here. I think it's important to not just, answer test questions without having a nice description or explanation as to why the answer choice is what it is. I think it helps with bringing clarity and understanding to the situation, and it also helps you to be able to see this distinguishing parts that made this stand out more so than that. So let's take a look. The correct answer is A. It is appropriate to remind the mother and the child of the child's progress and to discuss how the child can continue to practice using her skills after termination. It is also important to review steps that she can take if the child's symptoms return, including accessing services in the future if necessary. Many people react to termination with anxiety. Clients often want to continue services due to grief over the ending or fear of being unable to continue toward their goals on their own. Social workers should assist clients in becoming independent. Termination should include establishing an aftercare plan or referring clients to other services if needed. The mother's concern does not necessarily indicate that the child is not ready for discharge. The social worker should address the mother's concerns without reversing plans for termination. There is no indication that managed care limits are the reason for termination. It appears that treatment goals have been met. The social worker should explain that it is important for the child to continue meeting her goals independent of treatment. If the child's symptoms have improved and treatment goals have been met, it is not necessary to continue treatment regardless of the frequency of services. And so I think this explanation pretty much hit on all 4 points, really, outlining the fact that it's really important to make sure that you're helping the child become more independent, that we shouldn't really focus on the idea of the limits of service because of managed care, and that, you want to remind the mom and encourage her to use the tools and the skills that have been taught during sessions. That's all I have for now. I hope this information was helpful. I know, like I said, some of you have already probably read the question and answered it earlier, but sometimes I think being able to dialogue and talk about stuff in the open is more helpful. And so I just wanted to come on and kind of share that with you guys. Thank you for joining in. I appreciate all of your support, and continue to have a great afternoon. And I will see you next time on the other end. Bye for now.